Hi there.
Yeah.
My name is Samira.
Yes.
Thanks so much for being here. So I heard that you have some ear pain.
Yes.
Can you tell me about that?
Yes, my ear hurt is from the 10 years ago, and almost 1 year have a 2 or 3 times gonna hurt.
2 or 3 times? Okay.
Yes.
So this
Yeah.
ear pain happens 2 or 3 times every year for the past 10 years.
Yes, almost
Okay.
past 10 years, and this time is about to happen so 1 week ago.
Okay, so it's been going on for 1 week.
Yeah.
Okay. Which year is it?
Yes, this year.
This year here?
Left one. Yeah.
Okay. Can you describe to me how the pain feels like?
Yes, it's when a pain is like is hurt. Mostly is in the evening. It's hard to sleeping, and also is when the hurt is have some fever.
Okay. So it's worse in the evening. It's hard for you to sleep.
Yes.
And how does it feel like? Is it deep inside
It's
the ear?
deep inside, and
Okay.
also is sometimes cannot hear.
Okay. And just on this ear, you
Yeah.
can't hear sometimes.
Yeah.
Okay. Now, from 1 to 10, 1 is very, very little pain. 10 is a lot of pain. How would you describe your ear pain right
Yes,
now?
about 7 or 8.
7
This
or 8.
level.
Okay. So that's pretty painful then for you. Okay. So you said you had a little bit of a fever,
Yes.
right? Right now you have a fever?
Little bit.
A little bit? How is your throat? Any
Yeah,
sore
that's
throat?
also not so good.
What about your nose?
Yes.
A little stuffy?
Yeah.
Okay. Okay. So I also wanted to ask, when you're eating, does it feel painful when you're eating?
Yes, sometimes eating is pain.
Okay.
Yes, I can feel that.
Okay. Anything else you want me to know about?
That's okay.
That's
yeah.
it?
Yeah.
Okay. So we're going to start your exam. I'm going to take your temperature. Just going to put it in a fresh sleeve. Okay. Please open up your mouth. Put this under your tongue, and please hold this. Okay. I'm going to take your pulse. Okay. Let me take a look. Yes, it looks like you have a little bit of a fever, around 37.8, so slightly. I'm going to take your blood pressure. Does it matter which
Okay.
arm?
Yeah.
This one is okay?
Yeah.
Okay, just relax your arm down here. Okay. Can you raise your hand and pump your fist 10 times? Just relax your arm and line. Your blood pressure's a little high at 140/55.
Mhm.
Is it usually around this high?
Yeah.
Okay. Just gonna put on a pair of gloves. Okay. So I'm going to start by taking a look at your eyes.
Mhm.
Okay, open up. Can you look up for me? Just looking at your conjunctiva. And then can you look down? Good. Okay. So your conjunctiva is a little bit red, but not too much.
Mhm.
I'm going to look inside your nose.
Mhm.
Okay. So a little bit of redness, a little bit of discharge. Now can you hold one side of your nose and breathe out? Are you breathing normally? Okay. Other side. Okay. I'm going to look inside your mouth as well. Please open up your mouth and say ah. You say ah again, let your tongue out. Ah. Okay. There's a little bit of redness back there, a little bit of exudate. So it does seem like you had some sort of cold, some sort of infection, upper respiratory infection. Okay. Then I'm going to look at your ear. So I'll start with this one over here. Let me know if you feel any pain. Is that painful? Okay. What about this?
No.
That's okay?
Yeah.
Just looking inside your ear to see if there is any foreign body, any discharge, which I don't see. Also going to touch the back here. Any pain?
No.
Okay. Okay. Let me check the other side. Any pain here?
No.
No? How about this?
Yeah,
A little
that's
bit?
bad. Yeah.
Okay. And then back here, any pain?
Just no.
No. Okay. Take a look at side. Also no discharge. I don't see any redness. Okay. Now I'm going to check your lymph nodes. Let me know. Do you feel any pain? So it's a little bit swollen here. Okay. What about back here?
That's okay.
I think it's fine. Okay, I'm going to check your other lymph nodes. Okay. There's one that's swollen right here a little bit, but it's mobile. So that's good. Okay. I'm just going to have you just tilt your head this way a little bit. Good. Okay. Other side. Okay, I need you to shrug your shoulders for me like this. Okay, relax. So it doesn't look like there's any swollen lymph nodes from the lungs, so that's good. It's just a little bit here on this side and then in the front here. Okay. So now I'm going to go look deeper in your ears. I'm going to start on the other side. Okay. Let me know if you feel any discomfort. Okay. So this ear looks clear. There's no earwax. I can see the cone of light. There's a little bit of scarring, it seems, and I can see the bony landmarks. There's no redness. Yeah, this ear looks perfectly normal. I'm going to check your other ear now. Just going to... 1 second. Let me know if you feel any pain, okay? Okay. So this ear definitely looks a lot redder. I can see some dilated vessels, a little bit of scarring as well, and I can see, yeah, I can't see the cone of light, so there's probably some bulging from the back. There's a little bit of earwax too. Okay. So I want to do one more test. Basically, I'm just putting this pneumatic otoscopy attachment in here. And I'm just going to press it a little bit and see if your eardrum is moving properly. Okay. So your eardrum is not moving as well as it should. It has lower mobility. So it seems like it is harder. There's something behind it. Okay? Okay. So next part, we're going to be doing some hearing tests. So actually, I want to start with doing the whisper test. I'm going to whisper a 2-syllable word, and you're going to reply to me, okay? So on this side. Apple.
Apple.
Apple? Okay. This side. Kiwi.
Cannot hear well.
Can't hear on that side? Okay. Then let me try this. So when I strike this and put it on your head, let me know which ear you hear first, okay?
Right one.
Okay. And next I'm going to do the Renee test. So I'm going to strike it and put it on your mastoid process. You tell me when you stop hearing it. And when I bring it close to your ear, you tell me again if you hear it and when you stop hearing it, okay? Please close your eyes. Do you hear it?
Yes.
Tell me when you stop hearing it.
Stop.
Do you hear it?
Yes.
Tell me when you stop hearing it.
Stop.
Good. So your right ear is normal. Let's continue on this side. Keep your eyes closed, please. Do you hear it?
Little bit.
Tell me when you stop hearing it. You stop hearing it, or?
I cannot hear.
Let's try again. Do you hear it?
Yes.
Tell me when you stop hearing it.
Oh, yes.
Do you hear it?
A little bit.
Did it stop?
No, I cannot hear.
Not sure?
Not
Okay.
sure.
Okay. So based on the test that I just did, it seems to me that you have otitis media, so a middle ear infection. And is it usually on this ear? Sometimes it moves to this ear
Yes,
too.
sometimes it's right now.
Okay.
Yeah.
So because you're having recurrent middle ear infections, and I know you tried antibiotics in the past, and it helped, but then it came back.
Okay.
So I don't think antibiotics is the best choice this time, but I am going to refer you to an ENT specialist to take a look at your ears again and to see what's the best treatment for you, because there's a number of different risk factors that can contribute to middle ear infections. For example, do you go on the plane a lot? Do you travel on airplane?
Yeah.
Yeah, so that can increase your risk, for example. And also if you have problems with there's a tube that goes between your ear, your middle ear, and down to your throat. If you have some problems discharging, then that can also contribute to it. So we have to look closer and see what the root cause is, and then try to improve your situation. Okay? In the meantime, I can give you something to help stop the pain or lessen the pain, because I know it's really painful for you. Okay? All right. Thank you so much.
Thank you very much.
If anything else, be sure to call and let me know if I can help you in any other way.
Okay. Thank you.
Thank you.
Very much.
Bye.